Hello and welcome to Health and Wellness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. Welcome back to the Health and Wellness Podcast. We are on episode 2 with Don Elfenbein, MD, Master of Public Health, and Fellow of American College of Surgeons. And Don, I want to mention too here, you're the Vice Chair of Wellbeing in the Department of Surgery. We met at the Champions of Wellness Conference, and what really drew me in for you was your retirement story. And so today, I know the listeners, if they listened to last week's episode, are probably excited to hear this. I wanted to start out, when did the process of retiring start? When did you start thinking about this part of your professional journey?
Yeah. I think that there's a lot of things that happen that are automatic for residents, right? When you're a resident, you kind of you're a part of a health system that has some sort of retirement plan that you kind of have to pay into. And so I think that for a very large part of my early career I didn't think about it. It just happened for me and I was grateful that somebody else was forcing me to think about that. So that was nice. That was good. And then I think it was really something like maybe through my 30s when I was kind of in my early stages of my career, I was getting a paycheck, that was more than just the residency paycheck. It was important and I knew that it was something that we had to plan for, but it certainly wasn't top priority at all. I think that we were saving more. I had a financial planner at that point, who again I would just sort of said, here, I'm a long way off from retirement. Here's, what do you think I should do? And I would just do what he said. And then things changed when we had a kid. So I had a kid. I was almost 40 when I had a kid, and my spouse and I at that point really kind of had a conversation where we looked at what some of our values were, how we wanted to live the rest of our life. This kind of realization that like we only get one life, right? And although we were both really happy in our jobs and what we were doing, was there anything else that we wanted to do before we got to the point where we were needing hip replacements and had AFib and like all those kinds of things? Was there anything else that we wanted to do? So we started talking at that time, and then it became very real, and we started to become a lot more strategic about what we were doing with our money.
Absolutely. And the physical changes you mentioned, we talk about those in the book and in the health and wellness program too. They're wake-up calls, and they can happen throughout, but one of the big ones is time is finite. Life is finite. And it sounds like you had this really strong call to reevaluate and do an inventory and come up with a plan. So
Yeah.
could you tell the listeners a little bit about what you learned from that process and what your next steps are and where you're at today even?
Yeah, certainly. So as I mentioned, this all happened when I was pregnant. We kind of had this conversation that our lives were about to change. We were going to be responsible for this other human, and shaping them into hopefully a fully functional, compassionate, kind adult human. And at that time, my husband and I both did a lot of sailing. So my husband started sailing when he was 10 years old. He did a lot of racing of sailboats, and it just became this very big passion of his. I was always a boater. I was a rower in college. I do a lot of paddle sports. And so when the two of us got together, it's actually a lot easier to be on a sailboat with your partner than it is to be in like a rowing show with your partner. So that became the default boat that we would go in as a sailboat. So I learned a lot more about sailing. So we did a lot of sailing and racing. We bought a small cruising boat when we lived in California, and this is when all this was happening, that we would take back and forth to Catalina or just go on day cruises and things like that. So it was just a part of our lives. We enjoyed living a lot of our lives on a sailboat, but it was, we kept it on a dock, and we would go back and come home at the end of a few hour sail. And then when we had a kid, we started thinking about what it would be like to take longer sails to go places where we could explore, a different part of the world with our sailboat. Because a lot of people get on a plane and go to a different part of the world for a week or two, but we were investigating whether or not this would be something that we could do on a sailboat. So started really looking into it, and turns out there are thousands of people around the world that live on sailboats and raise their kids on sailboats, and are kind of living their life in a very, very unstructured way. My life is very structured right now. And so the living on a sailboat, your life is very sort of, it's very unscheduled. It depends on the weather. If the wind is blowing in the right direction, if there are no storms in the forecast, you can go somewhere else. But if not, you're kind of stuck where you are, and you have to figure out how to live there. And so we sort of started tossing that idea around and thought about when would be a good time to do that, when would be the right age for a kid to live on a sailboat. And we decided that would be when the kid was 10. So suddenly we had this 10-year plan. And it was really that. It was what's the right age for a kid to be on a sailboat. And if we really want to do this before we start to experience our own ailing human bodies, would that be a reasonable time? And we'll be sort of in our early 50s when this happens. So that was it. That was the sort of kind of lightning strike that happened. And it was a long process. It probably was a course of a couple of years where we really was like, it was kind of started out as like a haha, we should just go sail away on a boat to we could actually sail away on a boat to like people do this all the time. And this is a really cool, interesting challenge to be completely self-sufficient on the middle of an ocean. When your diesel engine breaks, there's no one else to fix it but you. So you got to become a diesel mechanic and a plumber and like everything on the boat is self-sustaining and self-sufficient. So that became this kind of common goal that we had, which I think is actually a really exciting thing for a marriage as well. So, we've been talking about careers and careers kind of stagnating, but I think that the same kind of thing can happen in people's personal lives too. You kind of get in a routine of things, but this became this common goal that we're working towards. So it's been really interesting and exciting to figure out how to do this. So that's the plan is so now I'm 47. So we're about 2.5 years away from deciding to sell everything we have and stop working the jobs that we're working now and live on a sailboat full time
So
in
you're
the
telling
world
me,
somewhere.
first of all, you're telling me that you don't have to be 60 or 65 to retire.
Right.
I think that's a
Hmm.
huge permission for others is if you have
Yeah.
this plan and you structure your finances accordingly, this can happen much sooner. And
Hmm.
as a coach, I'm a big metaphor guy. And so
Hmm.
really what you're saying is your journey will be defined by the weather and the direction of the wind. And
Hmm.
here we are with folks when they get to retirement, it might feel a bit like we're not just taking the day trips anymore. You mentioned going out for a few hours on a sailboat,
Yeah.
returning to the dock. That might be the weekend or the one day off that you have in a 7 day period. And all of a
Hmm.
sudden you're just saying, hey, let's just launch from the port, but
Yeah.
not flippantly. I want to say not without
Yeah. Yeah.
preparation. And here
Right.
you are telling listeners it's 10 years or more that might
Hmm.
it might take to really get your feet underneath you to get your plan in place and to get your abilities up to a point where you can take this on and make it happen. And so as we jumped on our call this morning, you mentioned too, um, you just got back. And so I'm,
Yeah.
I'm really curious as you're starting to take these longer periods away,
Uh-huh.
how are your first experiences of it? How's it going?
Yeah, they're great. Before we had a kid, we went on one sailing adventure with a bunch of friends in the Bahamas and thought it was very fun and it was a blast. It was an adult trip and it was a very different thing than we've been doing lately. But I would say, since we moved from California to Wisconsin about 6 years ago. We sold the boat that we had at the time. So we had a boat, we would do the day trips and things like that. So we were comfortable with sort of bigger boats. But since we've lived in Wisconsin, we've at least once a year, hopefully twice a year, have planned trips where we charter a large sailboat, and we're getting increasingly larger boats. So when you charter a sailboat, they would like a sailing resume. They want to see how big is the biggest boat that you have sailed before that you've captained, and that basically that you can manage because it's a big thing, right? You can't just jump on a boat and figure it out. And so we've been getting increasingly larger boats on each trip and bringing friends and family. So we brought my sister a couple of years ago and her kids who were teenagers at the time. This last trip that we went on was down in the U.S. Virgin Islands and brought some friends of mine from residency who now have kids who are around the same age as my kids. So now we had smaller kids on board and try to figure out, what's it like to live for an extended period of time on a boat. And it was 7 days. It wasn't an extended period of time, but for this other family, they really never they've been on a boat before. So living on a boat for them, that was a big deal. And seeing how the rhythms of the day kind of go and what to do when someone on board is not having a great time. How do you kind of pivot and redirect and choose a different thing to do? So there's that. There's just us getting comfortable with captaining and skippering and piloting the boat, and dealing with systems. I like it when I get a charter boat that's got something that's broken on it and I have to troubleshoot it. I think that's the surgeon in me that likes to tinker with things. So I'll tinker around and I'll pull stuff apart and I'll play with the electric systems and things like that. So it's been great. Those have been the things that we've been doing. We do a little bit of online learning. I think right now, if there's anything that you want to learn learn, just go to YouTube, right? And like
Yeah.
just look for it. You got people who record themselves on YouTube completely taking apart a diesel engine and putting it back together, right? So I can learn some diesel engine mechanic stuff just from on my own on YouTube. We've taken some classes that are local in the area, so we have a local sailing club that we'll get together with, and just learn things like weather routing and stuff like that. So all sorts of just new things that I don't think about for my job, obviously, but I have a little bit of additional bandwidth to think about for my future. So we're just trying to amass all this information that we'll need. And we probably will
Yeah.
never have enough of it. We still just got to go and figure it
Well,
out on the job.
what a beautiful message too. So to take this and just make it relevant for every single physician, doctor, surgeon that's going to be retiring, you do not need to know everything when you launch, but there's a wealth of knowledge out there on the internet that you can learn from. And so whether it's YouTube videos, podcasts, for example, on retirement for physicians, there's so much out there. And really, you mentioned it, just staying curious, just really remaining curious and finding things that you like to keep your hands busy can be a phenomenal way to find a purpose as long as it's, tied to a deeper meaning, tied to those values. But there's a whole arc, there's a whole web there of tying in activities and going from smaller boats to medium boats to larger boats. Like it's a building out process that starts with knowing yourself. And
Yeah.
that's where, I mean, your personality shines through you so brightly. The smile on your face right now, even it's just you're doing what you love and loving what you do, and it's clearly not by accident. But
Mhm.
what are the first few steps? What are the small steps to take if you were to give advice to someone who is preparing for retirement, similar to yours?
Yeah, I'll answer that in a second because what you were saying really resonated with me for a second about doing what I love and loving what I do. I think one of the most common responses I get, because I tell people all the time that this is the plan, that in 2.5 years I'm no longer going to be doing surgery, right? And I use that specific language. I don't say I'm not going to be a surgeon anymore, right? Because again, this whole identity stuff that's wrapped in there. But I'm going to stop doing surgery to go do this other thing and live on a boat. And a lot of people's response is, gosh, you must really be burned out or hate being a surgeon to have this plan to retire early, right? Because you're supposed to do this for as long as you possibly can. Like that's what we're all told, that you just like do this forever. That's the thing. And I really, really feel strongly that no, that's not the reason. I love being a surgeon, right? Like I love what I do. I don't think that because you love what you do, you have to do it 24 hours a day until you die, right? Like I just don't
Yeah,
believe. And so I really do like having this plan does not mean that I'm burned out or that I hate doing surgery. I in fact love it and I will continue to love it until the day I walk away and say bon voyage, right? And go do this next thing. And so I love doing surgery, but I also am really, really invested in this idea of being self-sufficient on a sailboat and raising a kid who has seen the world. And so those are really important things to me. So then I forgot your question. You were asking about advice for, I
yeah.
think.
Well, I do want to remind listeners too here. This isn't coming from a surgeon who's, gone and tucked herself away in the corner and just really figured out what she wants to do with her own life. It's from the vice chair of well-being also. And so you really do get to see a full spectrum of experiences. And so the advice that you do have for folks is coming from
Yeah,
a place of leadership and well-educated, attending conferences and doing the things that need to be done and applying this knowledge and practice too. And
yeah,
yet, right here
yeah,
in your life, what advice do you have for those folks that are preparing for their own retirement? Because you're
yeah,
injecting a lot of contra thinking, but whether
yeah.
it's the timeline or you know, what you're doing in retirement. A lot of folks, the highlight reel comes up, it's golf, it's hobbies, it's not setting sail on a sailboat for weeks or even months on end. And so, what advice do you have for someone who's approaching retirement, specific from your own experience?
Yeah, I think it really is that is try to figure out ways to disentangle who you are from what you do as much as possible, right? So who I am and what I do are very different things. They both speak to the same core values that I hold, but they are very different things, and I feel like I can separate them in a way that a lot of you don't learn how to do it when you're learning how to become a surgeon or a physician, and so really encouraging people to dig into that a little bit, try to figure out what those values are, what are the things that you love about what you do, and where do you get satisfaction from those outside of work. So really trying to disentangle who you are and what you do, and then don't be fearful, I think, of taking a different path. I guess don't be fearful of, even if you're on the traditional path where you retire at 65 or 70 or whatever that is trying to let go of that fear and allowing life to be what it's going to be, right? In that next stage of it. So I think that there's a lot of anxiety wrapped up into like, what am I going to be if I'm not doing this anymore? But figuring that out and spending some time thinking about that and figuring that out before the time sneaks up on you. I think that's the hard part, right? If it just sneaks up on you suddenly, and that's got to be impossible to navigate that.
Yeah, and I'd love your thoughts on this too. And this will probably be our final topic here as we wrap up. But you mentioned ramping up. You mentioned moving from
Mhm.
smaller boats, medium boats, larger boats. It went from the weekend trip or the hourly trip to maybe a week long or extended trips. So can you share a little bit about what the benefit had been for you ramping up to this retirement journey? And then
Mhm.
on that topic, is it okay to make mistakes along the way, to go through a bit of trial and error, and to kind of laugh at yourself a little bit if you try something and it's not for you? So the ramping up and then the trial and error piece.
Yeah, absolutely. There's ramping up and there's ramping down too, right? So as we're ramping up to the sailing thing, I'm trying to figure out how can I responsibly navigate leaving my organization, because I don't want to leave them in a lurch either. And so trying to figure out what things I can say yes to that are on my timeline and what things I can say no to that are not on my timeline, right? And so I don't want to commit myself to something that's going to be a 5 year project coming up. And I'm very honest with people in my organization when I tell them that no, I just can't take on mentoring an intern who's going to be here for the next 7 years, because that's irresponsible of me to leave in 2 years from that. So I'll mentor the intern who is a prelim intern who will only be here for a year, and I'll keep doing that every year until I leave. But really thinking about that long term plan and being honest with everyone around you. So there's the ramping up to the next thing, but also ramping down. I'm not ramping down my clinical practice. I'm not stepping away and becoming less engaged. I'm in fact, if anything, becoming more engaged. I feel this moral imperative to leave the environment of surgery better than I found it. And so I think that this vice chair role is very interesting and exciting for me as the last thing that I'm going to do. Hopefully, leave surgery in a way that is maybe more welcoming of all different types of people, and maybe has less rates of burnout. Maybe we'll see. I don't know what kind of impact I can have in that, but I'll keep trying. I'm trying to make the environment better. So yeah, so there's that. There's the ramping up, and then the very purposefully looking and trying to engage and disengage with things at work that make sense towards the end of a career.
Well, wonderful. And yeah, I had the opportunity and luxury of interviewing Jeff Thompson. He's the former CEO of Gunderson Health Systems here in La Crosse.
Mhm.
And one thing that he pointed out, he said, "Hey, as you're writing this book and you're mentioning that ramping down professionally, this is not senioritis. It's not retiring on the job. It's not, like you said, stepping away and being less engaged. It's quite the opposite. This personal element, you need time and space for that. So you need to be intentional about not taking on commitments that infringe on that, but really making it about a crescendo at the end of the year and leaving it in a very tidy space. It's like
Mhm.
leaving your house clean right before you leave for the work day, right? Getting the dishes in the
Yeah,
dishwasher and stepping away so that the next person that steps into it could take something on that's wonderful, and you're not retiring on the job. And he wanted me to be very clear about that point. We are not encouraging physicians to step down and retire on the job and hang on until they can squeeze the last penny out of their position, but
right.
being really intentional about leaving it better than you found it. So I appreciate you bringing that up too.
Yeah, absolutely. Yeah.
All right. So last piece here then, as far as the trial and error piece goes, not taking yourself too seriously. I mean, maybe a specific story from boating where things won't go according to plan, and that adaptability and malleability of the plan itself is just as valuable as the rigidity and structure and rigidity and planning that takes place ahead of time.
Yeah, gosh. I mean, there's so many examples in sailing, but I'll give you the example. The very first boat that we bought, so this 32-foot sailboat that we had in California, we had to sail it from Marina del Rey across and around a point in California to our home in Long Beach. And when you start out, you don't know that much about boats. We could sail great, and we would sail a boat, our 17-foot Thistle, all the time. That doesn't have any systems besides sails. That's it. You go on the boat and you sail it. Larger boats have lots of systems. They have electrical systems, they have plumbing systems. And we got on the boat and we started the engine and we started motoring out. We got out to the ocean where there was great wind. So we shut off all the engines and we sailed, and we had a great sail, and it was wonderful and it was amazing. And we got to our home port of Long Beach and hit the button to turn the engine on, and nothing, because we had left all the batteries attached to the systems that we didn't even need. We didn't need to have the refrigerator on, but we had the refrigerator on because we just didn't know. And so we had no batteries and we're floating out in the ocean outside of Long Beach, and had to figure out a way to sail sail the boat into a slip, which anyone who sails, it is hard. When you get into the actual tiny slip that's only 2 feet wider than your boat, and you have to do a 90-degree turn to get into that slip, you don't do it under sail. You take the sails down, you do it under engine, and you steer the boat into that. And we couldn't do that because we didn't have an engine. So we somehow managed to do that and sail our boat into the slip the first time, and we felt honestly like pretty impressed with ourselves for being able to do that. But it was such a dumb, stupid mistake that we made. We'd never drained the batteries again. We figured it out after that, but you figure it out and you sail the ship however you can.
Well, don't be afraid to sail into the slip at least once, and have some grace with yourself too. I mean, that's part of learning. And I think it's been a long time for a lot of career physicians since they've been the new kid on the block, learning new things, trying bigger boats with different systems. And
Yeah,
really rebuilding meaning in retirement is going to come with learning new systems, more complexity, and every once in a while the batteries are going to die. And
yeah,
here you are on the other side of it saying how proud you are. And so maybe don't be afraid of those adverse experiences. Sometimes those are the best teachers.
absolutely. Yeah, absolutely. We try to tell our residents that too, but yeah, it can be hard when you're in the middle of 80-hour work weeks indefinitely. Yeah,
Well, as you mentioned, the environment is just as important as the message when it comes to learning, right?
for sure. Yep, absolutely.
Wonderful.
Yeah.
Well, thank you, Don. Any final piece of advice before we wrap up our conversation?
No, thanks, Michael. It was great talking to you. I was wondering actually if you picked your background just for our conversation or if that's your typical
I, I
background. That was,
wish I wish that were the case, but yeah, there's such a strong metaphor there.
yeah,
That's actually the logo of Health and Wellness, and it's actually on the
nice.
cover of the book. And so
Uh-huh.
it is. It's a metaphor for kind of sailing out into the unknown in retirement. And so
Hmm.
Don, if I couldn't have picked a better guest for the metaphor to fit the background, thank you. I wish I could say yes, it was just for you, but your story is so compelling because it's so relevant, and there's a really strong metaphor there. So to have you, making this transition successfully and making this strong plan and really, putting decades of your life into making this become a reality and retiring at 50, is that the plan?
That's the plan. Yeah,
Excellent. Well,
yeah.
yeah, thank you again, Don, for being on the podcast. And I'm hoping to have you back. This has been a wonderful conversation. Thank you.
Great. Yeah, absolutely. And we'll always have room on our boat for people who want to come and see what it's like to go sail out in the ocean. So yeah, see you out there.
All right. We'll put a link to your email address in the podcast notes and people
Yeah,
can reach
perfect.
out. All
Great.
right.
All right. Thanks, Michael.
Yeah, thank you, Don. Take care.
All right. Take care.
Thank you for listening to this week's episode of the Health and Wellness Podcast. As always, I'm your host, Michael Schwartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwellness.com. We'll see you in the next episode.